We are live in the medical mile of San Marco at Baptist MD Anderson Cancer Center, celebrating 10 years of literally transforming lives in this community. And the future obviously looks tremendously bright for cancer patients who get the diagnosis, sadly, and so many that continue to get the diagnosis day after day, knowing that they have a level of care and holistic care, spiritual care, and of course, the treatment of the tumor and of the patient and of the cancer here without having to leave Jacksonville means so much. And part of that round level of care is support and lifestyle resources that are available to patients. And Theresa Pola is an outpatient dietitian who kind of oversees a lot of the social side, I guess, of treating the tumor. Would you look at it that way? Like, you got the doctors doing their thing, but like, you can focus on a lot of really impactful things for someone who gets a cancer diagnosis.
Definitely. I feel like lifestyle and prevention is also a component of this. So part of it is keeping them strong and healthy enough to tolerate the treatment throughout the treatment, get them through. The other half is, preventative. So what can we do to reduce the risk of reoccurrence and keep them strong and healthy in the future?
And do you see commonalities with people who are getting treatment, like, oh, they all eat a certain thing or they all eat a certain way?
Not necessarily. I feel like people come from so many different places, and part of our job is meeting them where they're at. So meeting them, whatever restrictions they have, kind of attuning our recs to their needs and who they are and what they enjoy. And
so you're a dietitian.
Yes.
What are some of your favorite foods to eat to prevent cancer? Like, what does Theresa eat every day?
I love produce is the first answer. So the trick is making it taste good. And so much of it tastes good, but it's getting it fresh, eating in season. All the fruits, vegetables, whole grains, nuts, seeds, beans. There's protein, there's fiber. They're delicious. It's just picking the right ones and knowing what you're doing in the kitchen.
And I don't want to put any brand names on the spot, so kind of delete those from your discussion of this or your answer to this next question. But is there anything that you definitely would not eat?
Oh, I'm a foodie in my soul, so there's nothing that is like off limits forever. I will eat anything one time. The trick is the balance. That's really what we talk about with our patients. It's not always a never. Those words can get us in trouble. It's most of the time and on occasion. You know what I mean?
So many people just breathed a big sigh of relief right now.
Me too.
Yeah. How does nutrition and how should it change during treatment after a diagnosis?
During treatment, our focus is really on keeping the patient strong and managing any side effects of the treatment. Protein is a number one. So protein is essential for tissue repair, for muscle preservation, for immune function, and needs are higher on treatment. So one of the things we do is we calculate our patients' needs based on their height and weight, and we give them strategies. We go over what foods they can incorporate. We base it off of their preferences, so that we can preserve their muscle mass and help them heal throughout the treatment.
It's fascinating because as we've gotten to know through the cancer journey across the way at Nemours with the kids who are treated there, a lot of times it's just a matter of getting something into their belly during treatment, and they're growing, so let's get them calories and whatnot. For an adult, that probably changes and evolves, I would imagine.
And that's a great point too. That's kind of the difference between on treatment and preventative is, there's side effects sometimes, and part of our job is managing those side effects. And, if they're feeling a certain way, what would reduce the risk of nausea? What's going to make this feel better or that? But you're right. Sometimes it's just we need energy in what can you eat?
And it's not just nutrition as well for the energy part of it. I would imagine exercise is a key part of it, relaxation and mindset and mindfulness. How do you all kind of look at that?
So many ways. And I think it depends on treatment versus preventative, like once we're done and we're reducing risk of recurrence. On treatment, we collaborate a lot. I mean, we work as a team. So it may be chaplain services, maybe social work, maybe us working together with the patient to figure out what their needs are and meeting them where they're at so that they can have the most positive experience they can in a difficult time.
And is that part of the holistic, multidisciplinary approach to kind of gauge stress levels?
Yes. I mean, and stress is such an interesting topic. When we're looking at from a preventative perspective too, we're really, there's been some studies that have shown that, stress which is associated with chronic inflammation can delay wound healing times. It can dysregulate our immune system and increase our risk of certain chronic diseases. So managing that in practical ways. Sometimes when we're looking at preventative, it can be getting sleep. It can be, practicing mindfulness. as well as eating like an anti-inflammatory diet. And that's going to be something rich in like our fatty fish, our olive oil, our nuts, tomatoes, cherries, berries, just getting it in, but in delicious ways and making it enjoyable, not a hassle.
And does trauma play a role in that as well, managing your stress? And because we usually see people who are stressed or who have gone through trauma making poor dietary decisions as well.
There can be. I mean, I would say yes, absolutely. And again, that's like meeting people where they are. There's so many different whys. You know what I mean? So sometimes one why we need a therapist involved. Sometimes it's working in tandem with therapy to figure out how we can best support a patient to get them the best outcomes.
Thankfully, not everyone will have to walk through the doors here or at another cancer center in the community. So for those who thankfully have not had a diagnosis come, is there a single greatest behavioral change you could recommend we take to try to help from preventative
We're
care?
looking for answers here when you leave, Theresa.
I have the answers. I'm going to give them really fast.
Okay.
But I would say limiting alcohol is a number one. Bring it down. If you do drink no more than 1 drink a day for women or 2 a day for men, a 14-gram ethanol serving is what I call a drink. So 5-ounce glass of wine, 12-ounce bottle of beer, or a 1.5-ounce serving shot of liquor, which I'm not recommending, but if you did, that's the measurement. Limiting processed meat intake, so deli meat, bacon, ham, sausage. There's an association between processed meat and increased risk of certain GI cancers. And then pulling back on red meat too. So keep it under 12 to 18 ounces per week. Limiting the processed foods when you can, doesn't mean a never, just reduce and incorporate more produce. Aim for 2.5 cups a day.
Yeah, you don't have to say never to things, but in moderation, as we've heard over and over again.
Yes, because it's the truth. It's all about consistency. What can you do for a long time? And any perfection is impossible. So what can we do? Most of the time we can usually do. Never's tricky.
We'll have to get some of your best recipes and post them
I
on
got you.
WOKB.com. I'm Theresa Pola, outpatient dietitian here at Baptist MD Anderson Cancer Center. Thanks for the visit.
Thank you.